Dr. Christina Chester, and welcome again to our MCPS video series, Waymaking. Our goal is to help families make their way through many of the emotional challenges we are faced with today. I have with me today Dr. Edelman, who's a school psychologist with the Preschool Education Program, or PEP. Thank you for joining us today.
Thank you so much for having me today, Dr. Chester.
All right, so today we are discussing how autism spectrum disorder impacts students. So for our first question, can you share with our audience, what does it mean to be a student with autism? How does this diagnosis impact students in our schools?
Autism spectrum disorder is a developmental disorder that affects how people engage with others, communicate, process information, and behave. Autism can be diagnosed at any age, but is considered a developmental disorder because characteristics most often emerge in the first couple of years of life. Autism is considered a spectrum disorder because there's a large variation in the intensity and nature of symptoms that individuals experience. Autism is present in children of all ethnicities and socioeconomic backgrounds.
No, and thank you for sharing that, because I know in working with families, it's good to hear that, it's a spectrum disorder, and that, because in the past there were all these different diagnoses of different things that are now combined under there to help people understand that, there is a wide variety of symptoms that can occur with those who are diagnosed with autism spectrum disorder. So thank you. So then can we get into, so what are some of the symptoms of autism spectrum disorder, and what are some of the things that students, families, and staff that they should be aware of if they have a student that has a diagnosis of autism?
Great question. Students with autism often display the following characteristics. Firstly, there's difficulty with communication and interaction with other people. So that can manifest in a variety of ways. Children sometimes have trouble sustaining eye contact. They have difficulty with that back and forth reciprocity or volley of conversation. They may speak at length about a preferred interest without regard for others' interest in that topic. It may be an interest like dinosaurs or makes and models of cars or insects. And they have difficulty taking on the perspective or understanding the vantage point or point of view of another person. They have problems making friends. So in addition to communication, we often see challenges in the areas of their interests. They have restricted interests and repetitive behaviors. So they may repeat a behavior or a word over and over again. They may have an overly focused interest in a specific topic, as we just discussed. They may become very unsettled or upset if there are changes in routine, departures from a routine that they cling to. And they may have sensitivities to sensory input, such as light, sounds, clothing. And what we know is that these various symptoms then affect their ability to be fully functional in the environment that they're in, be that the school environment, the work environment, navigating through relationships and social settings as well.
No, yes. And I know, especially I used to work with preschool kids, and, sometimes they do have things that they like monster trucks. But, what you're saying and talking about is, it's just like they're only doing this, or they have this real obsession with trucks or trains or other things, and they want to line them up and they want to do all these things, and that's all that they're doing. And so, and even with some of the stereotypic behavior, I've seen some students with autism engage in things like flapping. And so, getting into some of these things and talking with your mental health provider in the school can really help a parent who may have questions to try to tease some of this out in terms of what is kind of developmentally appropriate and things that may, start looking like something else. So, thank you for sharing that.
Absolutely.
And so then my next question is, what types of treatment supports are available for students with autism spectrum disorder?
Well, first of all, the earlier and more intensive the treatment for autism, the better the prognostic outcome. So in the clinical literature, um, it's not even the type of treatment, but the earlier and the more intense the treatment. That being said, many children with autism do benefit from a specific methodology called applied behavior analysis, ABA. It's a type of behavioral therapy service, and ABA will address the deficits that are present in the areas of functional communication, imitation, learning, adaptive or everyday skills, and then the play skill areas as well. Then when we think about the child with autism in the school setting, some students become eligible for 504 plans. Some qualify for an individualized educational program. So the 504 is a program that's providing accommodations for some of the symptoms of autism. So for example, a child may need extra time to complete assignments due to processing delays. But for students for whom their autism impacts their educational experience to a much more significant degree, they may need specialized instruction and supports in order to access the curriculum. In addition, many children benefit from speech therapy and occupational therapy services, and we often provide those in the school environment. And sometimes parents supplement with private therapies as well. And those services are intended to strengthen those adaptive skills, the communication skills as well. Many children with autism, their families secure social skills training for them so that they can break down and we can break down and teach those social skills. For example, social initiation, how to reach out and make overtures to another person, social interaction, how to look at another person, greet another person, return a greeting to another person, sharing, taking turns, cooperative play. Those skills don't necessarily come naturally to our children with autism, but we can break them down and teach them in very specific targeted ways. In school, children with autism often learn well when we provide an array of visual supports. For our little preschoolers, these come in the form of picture communication or picture symbol systems. Until the children are fluid verbally, we may use a picture symbol system. So for example, if we ask them to make a choice at snack time, do you want the pretzels or the cookies? And we have a little picture of the pretzel and the cookie, and the child who isn't yet verbal can still exercise his or her autonomy to make a choice by pointing to the cookies or handing the cookie card to the teacher so that we can respect his or her choice. So we use picture symbol systems. We use social stories. Social stories are little books that feature the student, and it helps them to navigate a difficult social experience like fear about going to the dentist, for example, and we write a little story about this is what happens when Sam goes to the dentist. And we break down all the parts of that experience, and we read this to the child over and over again so that the experience is no longer associated with fear and becomes much more doable for the child. Children with autism often benefit from social stories. We have visual schedules. Visual schedules are a breakdown of the child's day. So in the preschool arena where I am, we put the entire schedule on a board, and we have picture symbols along with the written narrative about, first we're having opening circle, then we're having snack, then we're going outside to play, then we're having speech therapy, then we have the whole schedule. And it's very comforting for children with autism. The visual modality of learning often resonates for them. And we find that they take comfort in referring to their visual schedule. And if they become anxious, we'll say, oh, Sarah, go take a look at your schedule. What comes next? What comes next? Oh, we just finished reading our story, so you show us what comes next. And that helps them. It helps them regulate their systems. Then we also have first then charts. So again, for our little ones, it helps them to have a task broken down into first and then. So we may say, first work, first you do your book reading, then we get to look at the computer. First work, then computer. And we pair a less preferred task, whatever that may be for the child. It may be doing a fine motor activity in art. Whatever is less preferred, we pair it with something that's more preferred. And this makes it more tolerable for the child. Those are just some examples of some of the strategies we use in school to set our children with autism up for success.
No, thank you. And that was a great wealth of information for our families. There are so many resources and so many supports for our students with autism in our schools. So thank you so much for sharing all of that for our families, our students, and our staff that are watching this today. And so my last question is, so do you have any suggestions or feedback for families and students to help them to stay resilient during this time?
Well, I want to say that children with autism have strengths, and part of my job as a psychologist is to help the school and the family to celebrate those strengths while simultaneously bolstering those areas of challenge. So during these unsettled times, the practice of gratitude in our clinical psychological literature helps to keep us positive and resilient during challenging times. So families can focus on acknowledging and celebrating the baby steps that their children are making towards mastery of those goals that are customized to each child. And very recently, a mother I was working with, she told me that she measures the progress in her child, not in milestones, but in inch stones. And that particular word really resonated with me. And I think that's a framework that we can all profit from and learn from, inch stones rather than milestones.
Thank you. No, that's a very good reframing. So I appreciate that you sharing that with us. And so, um, To close out, I want to thank you, Erica, for your time to be with us today. And as always, we want to thank our viewers for joining us for Waymaking. To send us any questions that you have or comments that you have, please feel free to go to the link on the screen. And always, please go to our YouTube playlist to find additional shows in our series. And please join us next time on MCPS Waymaking.